So immune bio approaches Alzheimer's disease as an immunological disease with symptoms of neurodegeneration. And what this means is that we believe the disease starts with the immune system. And as a result, you get these neurological deficits. By contrast, the scientific community in the Alzheimer's field views it as a neurological disease with side effects of immune dysfunction. Based on how you view the disease, your approach to treating the disease is going to be different. The Alzheimer's and scientific community have focused on a disease as a neurological disease, and they've identified things in the brain like amyloid plaques and neurofibrillary tangles, and have spent 20 years developing therapies to target those things without success. When you look a little more closely at the development of Alzheimer's disease, what we know is that the immune system becomes dysfunctional very early on, around the exact same time we believe Alzheimer's disease is starting. And so if you target the immune system in preclinical models, thinking about it that way, what you see is a change in all the different pathologies associated with Alzheimer's disease. So as it relates to plaques and tangles, loss of communication between neurons, loss of synapses, neurodegeneration, and so forth. When you approach it as an immunological disease, you design your trials differently because you're looking at different things. If you approach it as a neurological disease, you're going to design your trials one way. We know that way has not been effective. So what we've done is we've taken our studies, we've designed it by looking at the immune system as a causal factor. And this allows us or differentiates us in how we do our trials, the length, the duration, the biomarkers that we use. And in many ways, this is an advantage to us because looking and approaching it from an immunological perspective, what you get is shorter trials with fewer patients, as opposed to if you approach it the traditional way, these are minimum 1.5 to 2 year studies with hundreds and hundreds of patients, potentially thousands of patients. So we think this is not only makes sense from a mechanism point of view, in other words, there's plenty of evidence that the immune system is involved, but it also allows us to get through clinical development faster and patients to get answers quicker. And we think ultimately this will have a large benefit on the entire field, and also having a different perspective of looking at the disease from different ways is ultimately what's going to move us forward.